what you expect to see in a 3D tactical solution seminar is going to be pretty much a one-on-one. One of the things I wanted to introduce and maintain is the camaraderie of being able to work one-on-one with me, with any of the other doctors or facilitators in this curriculum, to where it's a safe place. You're vulnerable. You can get together, and I don't have all the answers, but one of the keys is diagnosing, being able to see and diagnose whatever concern or problem a patient presents is the key. Treatment planning from there is really up to you, your expertise, what you're familiar with, what the patient can afford, your education with the patient. All that all kind of dictates a variety of different treatment plans. But being able to diagnose is key, and being able to have a community of support with myself and other representatives, other dental reps and other dentists, to where we can camaraderie, we can communicate back and forth. And so this, what you'll expect to see is a very personable interaction, training, discussion about cone beam technology, what it does for your office, what you can't see. The training will be done separate with your staff, so the staff will be receiving the same training, but they'll be actually receiving it from my staff members, from my assistants, from my front desk. I've had my front desk for 26 years. One of my assistants been with me for 20-something years here at this office, and they've gone through this whole change. They've seen it, they've embraced it. They understand it, and so they'll be the ones teaching your staff, and then you'll be sitting in with me and other doctors and other representatives, being able to rub shoulders, and ultimately being able to see how you take a patient in a patient situation and be able to do the CAD/CAM, to be able to transfer the files from CEREC to Galileo, design the implant, mail the guide, take the guide right to the mouth, perform the surgery. We'll do a live surgery, no mirrors, no other rooms. You'll be or cameras or other rooms. You'll be sitting in there one-on-one or 1-on-5. If we've got 4 or 5 doctors, you'll be sitting in the room, looking and seeing how to place the implants. So if you're familiar with placing implants, fantastic. You're going to have a one-up and being able to see what an advantage it is to do it guided. If you haven't done any implants, like I had not done any implants prior to receiving my first, buying my first cone beam, and going through being able to understand, the placements, the multiple factors and reasons why you placed an implant, but taking all of that and taking it into a live patient, being able to see it start to finish, and be able to then talk about return on investment, how that will benefit your practice, how that will benefit you, and just the absolute control that it gives you in direction and treating patients. It's a fantastic curriculum. We're excited to present it and give everybody an option to see it. So.